In this video, we're going to talk about a very important topic, which is acute leg ischemia, also known as cold leg. And it happens when all of a sudden the blood flow to a leg or an arm completely stops. This is also a life-threatening condition because a dead leg will produce toxins that can actually affect your heart and all your other organs. So this is a medical emergency. 6 P's describe the progression of the symptoms when there's lack of blood flow to your leg. And they include pain. You can't feel a pulse, so it's pulseless. The leg gets pale, it gets white. It also gets polar cold, it's very cold. And when the ischemia progresses, and with time, if nothing is done, you may develop paresthesia, which is a nerve injury, so you lose sensation of that leg. And with time, you may lose complete mobility of the leg, and the leg may become paralyzed. Now, most of the time, this happens for one of two reasons. You either throw a clot from your heart, usually related to atrial fibrillation or AFib, and this clot travels all the way to the leg and blocks the blood flow. Or it's somebody that already have blockages in the legs and you develop a clot inside the blockage because the blood flow is already poor. And it's usually very easy to differentiate between the two reasons because the patients that have a clot usually have normal arteries. So the other leg, you can feel the pulses and the other leg looks normal. Whether patients that have history of peripheral artery disease or PAD, they also will have likely some problem in the other leg that we can detect on physical exam. Now, how is a cold leg actually diagnosed? You don't really need any test to make the diagnosis. It should simply be a clinical diagnosis that can be made by any physician by the physical exam. But sometimes we may do an ultrasound or a CT scan called a CT angiogram, more to plan how we're going to treat this and so we don't have any surprises when we go in. And we usually get access in the other groin or sometimes even in the wrist. And we navigate to the affected leg and then we shoot some pictures to identify the reason. Then we use some fancy equipment to actually remove all the fresh blood clot that is located in that leg. And that's what we do first. And sometimes that's all we need to do. Once the clot is completely removed, we'll also take a look at your arteries in general. And if you have like a chronic plaque or a blockage that may have caused the whole situation to start with, then we can treat that like we treat any other plaque with either a balloon, a stent, or sometimes even devices to remove the plaque. I hope this video is helpful. This is Minimally Invasive Insights, and I'm Dr. Fabio.